I'm Kathleen Kujiraoka, aka Dr. K of Radiant Kaneohe Smiles. And I wanted to talk about implants. Actually, I should say we wanted to talk about implants today because I have with me Jocelyn, who is one of our hygienists. And she knows dental implants, of course, from the dental side, but she also has the experience as a patient, so she can give the patient's perspective. Whenever there's a tooth that's missing, whether it be from decay, fracture, or some other reason, there are several options, basically 3 options to replace those missing teeth. So the first is a removable partial denture, so that's something that comes in and out of your mouth. The second is what we call a fixed bridge, and that is cemented in your mouth, so it stays there and it doesn't move or come out. And the third option is what we call a dental implant. And the implant is integrated into your bone, so it's almost like being a part of you. So of the 3, the implant is the treatment of choice, and more people are doing it these days because of the success in the surgery and just the overall comfort of dental implants. So of the 3, the implant is the most like having your own natural teeth. So the way they look, the way they feel, the way they function, you can chew. It's just like your own teeth. The advantages of having an implant are there's no decay on implants, so you don't have to worry about getting cavities. It preserves the bone, and it's pretty much unnoticeable, whether it's to people that are looking at you or even to yourself, the way it feels. The removable denture can be bulky. Sometimes it kind of moves around, so the comfort is not the same. With the fixed bridge, it is more comfortable, but because it's anchored on 2 natural teeth, those teeth can get decayed. The teeth can also fracture, and then you're going to end up losing the whole bridge. The whole bridge is going to have to be redone at that point. And generally, statistically, bridges need to be done at least once during a person's lifetime. So Jocelyn, I was hoping you could share with us what the process was like for you to have the implants placed.
Quite interesting. On my first implant, we really, they took the tooth out, and they placed the first portion in, and then that was it. I healed for about 4 months. Then they placed the second stage in, healed first 2
So the
months.
first part was the actual titanium post into the bone.
Yes, so they placed that in the bone, and then when they did the second stage, I healed up, and then they did the third stage. So that took about a year. The stage 1 was when they put the titanium post into my jaw. The second stage was the kind of like an abutment. It kind of stuck up over my jaw.
Okay, so that was probably the healing cap.
Yes, that was the healing cap. And then the third phase was when they put the crown on. Yes, and that took about a year from start to finish. Yes. My second implant was so much more easier. They removed the tooth, let me heal. Well, they did the bone graft, and sometimes you do need a bone augmentation.
Right.
And you heal up for 4 months. Then they, at the second month, while I was healing, they took a 3D scan, and with that, they made a surgical guide. And then 2 months later, they did that implant placement. And that implant placement, when I did the first stage and the second stage, it was just one thing. And so now I have the healing abutment in my mouth. And so that altogether, from the time I took my tooth out to the time I had this in here, was a total of 4 months. Healing, placing it in, and my doctor said in about 8 weeks I get to have a crown.
Wow, that's
pretty
nice.
fast.
Yes. So for Jocelyn, actually she had 2 implants, and they both were a little bit different, and this is typical for, it varies from patient to patient. So for the first situation, she didn't need to have any bone augmentation. There was enough bone there. The second one, there was not enough bone, so there had to be some bone added in there. And when she was talking about the stages in the implant procedure, the first part is there's a titanium post that's put into the bone, and that's what's going to act like the root of your tooth. So first the bone has to fill in around it. When it gets stable, then they're gonna expose that post. So initially it's kind of covered up under the gums, and then they're gonna uncover it, but then they have to put a cap on it so that the gums can form around that tooth in the proper shape or configuration. So there's a cap placed while that's happening. And then at the third stage, when the restoration is done, that cap is removed, and we get an impression first. The lab makes the crown, and then we can put that right directly onto the implant that's underneath the in the bone. So that's what the 3 stages are that Jocelyn's referring to. And also, like we were talking about, varies from patient to patient. You may or may not need the bone graft. Sometimes the implant integrates really quickly. Sometimes it takes a little longer. So for some people it might be maybe even like half a year or so, or even shorter. Some people it might extend out. Joss's first one was a year.
Second one was
That's quick.
Pretty quick, yeah.
Yeah, and you were saying they're estimating maybe by the time it's done, total was about 8 months.
About 8 months, yeah.
So there's a difference there, and so it just really varies. Everybody is individual. Their mouths are different. Situation is different. So it can, there's a range, but roughly figure like maybe somewhere around a half year, maybe a year. If there's other things that are involved. How do you like it?
I am amazed because the first time I couldn't chew. I had to wait 4 months. I had to wait 4 days to like really chew something hard. The second one was pretty amazing. The day of, I didn't really feel any sweating the second day. The first day I just took some pain meds, which is your standard 100 or 800 ibuprofen, and I took some antibiotics and ate some ice cream. But I didn't feel. It felt like I was worked on, but it didn't feel like too tender. So it's wonderful. It was wonderful.
So Joss, when it comes to surgery, I know a lot of people have concerns about pain or discomfort. What was your experience?
It was not too bad.
Not too bad.
What I'm saying is, I'm a very phobic patient, and when I was going through the process in the chair, I actually didn't experience a whole lot of pain. I was pretty comfortable. I took the antibiotics before, and after the surgery, felt like I was worked on, but it wasn't terribly sore.
So not as bad as you were expecting.
No, not as bad as what I was expecting. Absolutely. Not even swelling the day after. I was like amazed.
And how do you like your new implant?
I love it. I love it. I can function. I can talk. And even with the new one, the healing abutment, even though it is sticking up, I can eat and talk, and it's comfortable. I don't really notice it. My first implant feels like my own normal tooth.
Jocelyn and I have been talking about missing teeth where there's still a lot of natural teeth present. There are some patients who have no teeth left and they're wearing full upper dentures. And implants can also help patients with full dentures with no teeth, because the implants can be used to secure the denture so that it is stable and it's not flopping around, and they can get a lot of chewing function as well, much more than with just the dentures that, it's because it just sits on the gum. So there's something to anchor it. So with the full dentures, the implants can also be something of benefit as well. We have Jocelyn. She took a picture of herself, and this is the implant that has been already placed. This is her new implant, and you can see the healing cap here. And later on, this cap is going to be removed and her crown will be in place. And as you can see, it looks just like a natural tooth. Here is showing a view kind of from the chewing surface, the top of her implant that's already in place. And this is the little cap that covers the implant as it's healing underneath the bone. And we have some x-rays as well. So this was of her first implant, and at the time her tooth was in place. And the reason she had to have actually both implants was that there was a fracture along this root. So she lost this tooth. So this is with the completed implant. This is with her tooth before the implant, the second implant. And then this is a picture with her second implant in place. So this one is a little bit wider, but basically same idea. So the cap here, and eventually this is going to be removed and the crown is going to be screwed down onto this implant. The cost can vary depending on what needs to be done. It's not always a straightforward just placement of the implant. Sometimes there needs to be some bone augmentation, or there might be some other procedure. So that will vary. We really won't know until we do an evaluation first. And then we would make a referral to the surgeon and they will have their evaluation as well. So it's kind of a range. As far as the insurance, that varies as well. The insurance companies, some of them are starting to pay towards the surgical placement of the implant. Not all though, and I would say the majority do not. However, there are more and more insurances that are covering the crown, the part that it goes on top of that implant, the restoration, the part that looks like your tooth. So some insurances don't cover anything at all. And again, that is something that either you would need to check into, or if you come in, our ladies in the front would be happy to check for you. Would you recommend implants?
Oh, absolutely. When I see patients, I always tell them, if you are down that road, you go and get a consult to know what you're looking at, because it can pretty much surprise you.
Mm-hmm. Yeah, so from a satisfied implant patient. If you feel like you might be able to benefit from implants, please give our office a call, or you can contact us anyway with the information that's below. Thank you very much. And thanks, Joss.